Welcome back to Mornings with Zerlina. Representative Jennifer McClellan is a Democrat representative from Virginia's 4th District. Good morning, Congresswoman. Thank you so much for being back with us.
Good morning.
So it's Black Maternal Health Week, and we've talked previously about your own experience as a mother who nearly died in childbirth. Tell us a bit about your story and how much Black Maternal Health Week means to you personally.
Yeah, so it was 10 years ago. My daughter was due on June 30th. I had placenta previa, and I woke up to go to the bathroom, and when I laid back in the bed, my placenta ruptured and I started bleeding, was rushed to the hospital. And I remember going into the emergency room, hearing a doctor say everything is fine, and then immediately saying that we've got to go right now because both my and my daughter's heart rate dropped. And I remember feeling terrified, but having the peace of mind that my doctor could make the decision that she felt necessary in that moment. And now, 10 years later, when my daughter reaches childbearing years, she might not have that same peace of mind. And it's outrageous. But she, 9 weeks early, 6 weeks in the NICU, we were lucky, but so many Black women and Black babies are not so lucky. And so I always focus on how we can address the maternal health crisis generally, and the fact that Black women are 3 times more likely to die in childbirth than white women.
And these are preventable deaths. So talk a bit about why it is that Black women are so disproportionately impacted by the maternal health crisis.
There are so many reasons. And I've looked at a lot of the Virginia data specifically, but Black women tend to die of other issues that are exacerbated by childbirth. So cardiovascular, oftentimes you will have a Black woman who has her first heart attack either while she's pregnant or shortly after childbirth. Or you will have, sometimes, and Serena Williams is the most famous of this. Yeah. You go to the hospital feeling like something is wrong and being told, oh, no, you're fine. So I met a woman who, she had her first heart attack right after her daughter was born. She went to the hospital and she said, I'm having a heart attack. And they're like, no, you're not. You're a 36-year-old woman. You're healthy. She had a heart attack and she ended up having to have a heart transplant. So, we tend to live in areas that we have higher rates of cancer. We don't have access to prenatal care, more in higher numbers, and so it's a part of a larger problem that Black women tend to have disparities across the healthcare spectrum. And the maternal health crisis is just one example of all of that.
You're a co-sponsor of the Black Maternal Health Omnibus Act, and we were joined yesterday by Representative Lauren Underwood. Talk a bit about what is in that bill, because I feel like it's a big piece of legislation with a lot in it, but I want folks to understand how it would help make the problem better.
Well, it would take action through, very historic investments in things that would address some of these disparities in other issues. And so it would invest in social determinants of health, like housing, transportation, and nutrition, because if you don't have access to transportation, you can't go to your prenatal care appointments. It would expand eligibility for WIC into the postpartum and breastfeeding periods, because if you're not eating healthy food postpartum, you can't recover. A lot of people don't understand that childbirth is a significant stress on your body, especially if you've had a C-section. So you need to eat healthy to recover. You need to eat healthy to be able to feed your baby if you're breastfeeding. It would support community-based organizations that are working to improve maternal health outcomes in general. So in my district in Richmond, we have an organization called Birth and Color that helps connect Black women, especially in low income areas, to doulas if they need that, or it helps provide transportation to their prenatal care. So those are some of the things. There's a lot more in there, but it basically we know why. We know why women and Black women die in childbirth. We know when, and it shifts our public policy and our investments in a way that addresses those root causes.
One of the things that you said that is alarming is just how vulnerable Black women in particular are after they give birth. And I think about that fact in line with the fact that the Republican budget cuts Medicaid drastically. Talk about the impact of that.
So we had, in Congress and in many states, we've expanded Medicaid coverage. So it used to only cover the first 6 weeks after birth, for pregnant women, and we expanded it to cover the first full year because, again, a lot of women, and Black women in particular, they don't die from complications in the first 6 weeks. They do within the first year. And so that's one example. If these cuts roll back that expansion and now you're only going to be covered the first 6 weeks, you're not recovered. There's a reason that people usually take 12 weeks of leave, and even then you're still vulnerable to infection. Or if you are likely to have a cardiovascular event, it's going to be after that 6 week period. But it's also, when people are on Medicaid, they are more likely to be connected to a healthcare home. A lot of people don't get preventative care because they can't afford it. And if you're not getting preventative care, or you're not getting just your everyday checkups when you get pregnant, if you've already got an underlying issue like diabetes or a cardiovascular issue, you, you're going to have a much more dangerous pregnancy. Mm-hmm. And so Medicaid ensures that you can get your annual screenings, you can get and stay healthy. And studies have shown that Medicaid patients are healthier because they've been connected to that healthcare home. And they're usually, when they do show up for treatment for something, it's cheaper. So all of the Republican efforts to cut Medicaid, which they keep lying and saying they're not going to, but the Congressional Budget Office has said they can't reach their $880 billion goal in cuts in the Energy and Commerce Committee that covers healthcare without it. These cuts are going to make the maternal health crisis and many of the other healthcare disparities that we see worse.
One of the things that's made the crisis worse is the Dobbs decision. Can you talk a bit about the impact of Dobbs on the maternal mortality crisis? Because in Virginia, obviously, it's one of the states where abortion rights and elections wins by Democrats have protected rights to the full slate of reproductive health care, but that is not true in so many other states.
Well, it's not a coincidence that the states that have adopted abortion bans or restrictions post Dobbs are also the states that have the highest rates of maternal death. And that's because even in states where they allow abortion in the case of the life of the mother, you got to be sick enough. So you've seen the stories of patients who show up having a miscarriage at the emergency room, and they're told to wait in the parking lot until they're septic because they're not sick enough. Well, once you're septic, odds are you're going to die. Yeah. And we've seen that. Or you'll have people who have high risk pregnancies, or like my doctor told me about one of his patients who was a woman who had a hole in her heart. And she knew if she got pregnant, she would die. She's on birth control. It's not 100%. She got pregnant. She had to make a very difficult decision. But in a state that's banned abortion, that decision's taken away from her. And so those are just a couple of examples of how this has made it worse. But then go back to my original story. When I was wheeled into the emergency room, at what point would they have said, we got to go? And would that doctor have had to go check with the lawyer and say, okay, is it close enough now, or do we need to wait? So when you take healthcare decisions away from patients and providers and put them in the hands of politicians, bad things happen. And that is exactly what we have seen since the fall of Roe all over the country.
I want to shift gears and talk about the SAVE Act because there is a vote happening in the Senate with regards to this legislation. Tell us what the legislation would do, because every time I get an elected official on here, I want people to know what this legislation is and what it will do, because it's really bad. And I feel like not enough people are talking about it.
So essentially, it's a poll tax. What it does is it requires every voter to provide documents to prove your citizenship before you can register to vote. And oh, by the way, the only documents allowed under the act cost money. Mm-hmm. So it's a real ID, a passport, a certificate of citizenship. These range from $42 to over $1,000. And the only ID that is free is a military ID if you also have all of your papers that sort of your military record that shows where you're stationed. But oh, by the way, the bill basically eliminates mail and online registration forms. So if you're military stationed overseas or away from your residence, you have to show up to register in person. So, and what a lot of people don't realize is if your name is not the same as what was on your birth certificate, it's a lot harder to get a real ID or a passport. And you've got to basically prove your chain of custody of your name. Well, 80% of women that get married change their name. So now you said to married women, you said to active duty military personnel, you said to homebound voters, you can't register, or we're going to make it very difficult for you to register. This is voter suppression 2025. This is poll tax 2025. This is Jim Crow 2025.
How is it that they are getting away with pushing this without much blowback? Because it seems to me, especially, married women, that's women on all sides of the political spectrum, yes. Right? So why aren't they taking more flack for the fact that they are trying to suppress the vote of women who are married who change their names? Because that includes conservatives.
Because they're very good at propaganda, and they're very good at obfuscation and misinformation. And so they say this bill is to stop this crisis of non-citizens voting, which that crisis doesn't exist. It's already illegal for non-citizens to vote. They can go to jail for it. I haven't seen anybody prosecuting anybody for this. So we've seen no evidence that it's actually happening. And when they present the bill, they say, yeah, this is all it does. It just says, you have to provide these documents. They don't go the next step to say, well, these documents cost money. And that was a red flag for me because, Zerlina, I took my oath of office on the Bible that my father kept his poll tax receipt in from when he first registered to vote in 1947. So the minute I saw this bill, I asked my staff, what are the documents that count and how much do they cost? And every single one costs money. And I'm like, that is a poll tax, which is illegal under the Constitution, under the 24th Amendment. But most people who are watching the news or hearing this, they're not triggered to ask that question because their parents didn't have to pay a poll tax. Right. So they're very good at wrapping up their voter suppression in the propaganda and blaming their boogeyman for some fake crisis that makes people not ask questions.
Relatedly, I feel like they are creating boogeymen out of people in this country who are here without the proper documentation. And I am sure you have been following closely, as we all are, the case of Kilmer Abrego Garcia, who was removed from the United States and sent to El Salvador when there was a court order prohibiting that exact thing because of the risk to his life. I mean, if we are in the situation, which we are, where you have an administration that is openly defying a court order saying that the government needs to facilitate his return, are we in the constitutional crisis that everybody was warning about?
Absolutely. And Zerlina, it's worse than you said. Okay. He wasn't just removed. I mean, imagine you were driving home with your 5-year-old child. You were pulled over by masked men who grab you, handcuff you, throw you in a car, transport you to an airport, put you on a plane, send you to an El Salvador prison where your head is shaved, and then they say, "Oops, we sent you by mistake." They admit to the court, "We did that by mistake." And now they say, "Oh, well, we can't get you back." And have the president of El Salvador sit in the White House with the president of the United States and say, "Oh, we're not sending him back. Never mind, the Supreme Court in a unanimous decision said to do it." So this is not just a constitutional crisis. This is fascism. This is something I never thought I would see in the United States. And now he's talking about sending American citizens.
Right.
It's horrifying. And every American should be outraged by it.
I think one of the things that folks need to wrap their brains around is something I've been trying to explain every single day on this show this week, which is that when they eliminate due process, right? They can say you're a gang member. They can say I'm a gang member. They can say anybody's a gang member and remove them from the country, kidnap them off the street, shackle them, and send them to this maximum security prison or another place, and say we can't return you, even because there's no process to determine whether or not that person is a criminal. They can just tag you as a gang member or a terrorist and do whatever they want. I mean, that is authoritarianism. This, we know exactly what this is.
And the images from that prison reminded me so much of scenes from the Holocaust. And again, these are things we never thought could happen in America, where we have a due process clause in our Constitution that prevents exactly that from happening. And this president, who swore an oath to preserve, protect, and defend the Constitution, is ripping it to shreds, while congressional Republicans sit by and do nothing.
What can Democrats do? Obviously, I know that you're in the minority. There's very little that you can do legislatively without the majority. But I feel like, it was good to see Senator Chris Van Hollen go to El Salvador and try to get his constituent back to his family. But it feels like there needs to be a bigger show. And I'm using that word intentionally because Donald Trump is good at putting on the show. So what kind of show can Democrats put on that demonstrate to the American public that we're in an emergency and that you are fighting for upholding the rule of law and the Constitution?
It's a wide variety of things that we're trying to do. We can call out what is happening, just like I'm doing right here, because of course the propaganda that the Trump administration is using, tries to gloss over, well, these are criminals that were just getting off the street. They don't go the next step and say, yeah, but with no hearing and by mistake. So we can call all of this out. We can't file lawsuits, but we can join in lawsuits that other people file with amicus briefs. We can use our oversight through letters or shadow hearings to raise awareness among the American people, because at the end of the day, we do not have the power through legislation to stop the president. We need 3 Republicans in the House and more than that in the Senate. But at the end of the day, it is going to be the courts and the American people who are the final backstop to determine if our republic survives. And so our job is to make sure the American people know what's happening and make their voice heard. And we can help them do that. And then we can make sure that these lawsuits get to the courts, and then hope that, and I still have faith that at the end of the day, the Supreme Court is going to do its job of oversight. But if we put enough pressure on my Republican colleagues to do their job, we only need 3 in the House. And we have seen when the American people start to turn on the president's policies, he backs down. So it really is an all hands on deck moment. We need the press to do its job. We need members of Congress to do their job. But ultimately, we need the people to make their voice heard and say, this is not what we voted for. This is not who we are as Americans. We demand that you stop.
In the last few minutes here, I have one last question, and it's really just about how the Trump administration is operating in this particular moment with regards to thinking that the immigration issue and Democrats citing and advocating for the release of Mr. Garcia is like a losing issue for Democrats, right? They're clearly operating under the premise that the vast majority of Americans are on their side when it comes to immigration. How do you plan on talking to your white constituents about why they should care about the case of Kilmer Abrego Garcia or any other person who has been removed from the country without any due process?
If it can happen to him, it can happen to you. If what Donald Trump is doing, begins a slippery slope where you can be disappeared if you disagree with the leader. And I believe that the vast majority of the American people, even if they think that we have a crisis at the border, even if they think, and the Democrats agree that we have to reform our immigration system, but we have to do it in a way that recognizes the humanity of immigrants. And the fact, I mean, again, go back to the SAVE Act. The SAVE Act is designed to target immigrants that are, and designed to target non-citizens, but by requiring citizens to jump through hoops to be able to vote. So, it's not just about brown people with tattoos. It's about human beings. It's about a father who was in his car with his 5-year-old son going home from work, who is not a gang member, who did nothing wrong, and is now sitting in a prison in El Salvador. And the administration admits it was by mistake. Right. If it can happen to him, it can happen to you.
Congresswoman Jennifer McClellan, Democrat representative of Virginia's 4th District, thank you so much for being back with us to talk about Black Maternal Health Week and so many of the other critical issues we've been following all week long. Thank you again for being with us.
Thank you.
Stay safe.
You too.
We're going to take a very quick break, and we're going to wrap up today's show with the Lieutenant Governor of Illinois, Juliana Stratton, will be with us.
Because sometimes